Well, hey guys, welcome back to the Friday Q&A. Today I'm going to be addressing all of your questions about hormonal acne. This is a topic that I get a lot of questions about, and I did a whole series on tretinoin for acne, anti-aging, and post-inflammatory hyperpigmentation melasma, and I got a lot of requests through those videos to do a video on hormonal acne, and if I could talk a little bit about that. So that's what I'm going to address today. If you're new here, welcome. My name is Andrea. I am a dermatologist. I film fun vlogs of my life. I share fun recipe videos, but I also film quite a bit of skincare related content, namely skincare ingredient reviews, skincare product reviews, and a skincare Q&A every Friday. Goes live noon Eastern Standard Time. And those Q&As, FYI, can be found in a playlist on my channel entitled Skincare Q&As. So if you miss them one Friday, you can always go back and watch them and rewatch them over and over again. So if this type of content is of interest to you, then I encourage you to stick around for more. So hormonal acne is something that plagues late adolescent and adult women, unlike acne of teenage years, tends to persist for several years, can flare cyclically, particularly with the menstrual cycle, and its pattern of distribution, meaning where the acne occurs, tends to be a little bit different than in your classic acne of teenage years, wherein the acne tends to be on the forehead, the nose, the cheeks. The female or hormonal acne of adult acne tends to localize around the jaw area. Particularly, it can be quite painful. It can be quite cystic, meaning large nodules that are deep in the skin and very inflamed. And because there are these types of lesions comprise adult hormonal acne, it is important for you to know that if uncontrolled and untreated, hormonal acne does have the potential to leave behind scars. And by scars, I mean a noticeable divot in the skin, okay, that is very, very difficult to later correct, all right? Furthermore, acne, any type of acne, but hormonal acne in particular, given that it tends to be cystic, can also leave behind something called post-inflammatory hyperpigmentation, or dark spots, that people often interpret as a scar, but are, leftover kind of pigment mess, if you will, from the healing acne. And that does have the potential to get better, but can take a lot longer than anybody wants to deal with. So very important, if you are somebody suffering from hormonal acne, that you realize that it is a disease with cyclical flares. It can, truck along doing just fine for a period of time and then flare later on. So it's very important that you follow up consistently with your treating dermatologist, period, and not try and DIY masks and things like that to make it better, because there is an internal component that drives it and needs to be addressed medically in order for you to have optimal control and to ensure the health of your skin and to protect you from scarring. Not to mention the fact that hormonal acne, any type of acne or skin condition for that matter, it affects the way we feel, it affects the way we function, it can be very limiting in terms of our willingness to go out in the world and interact with our peers. It can lead to isolation and feelings of depression, low self-esteem. So none of those are good things, okay? So it's very important to follow up consistently with the treating dermatologist. I think the term hormonal acne can be a little scary, honestly. It sounds like, there's some gross abnormality in your circulating hormones, that they're, quote, out of whack. I hear a lot of people describe them. So I will get into now the fact that there are some underlying medical conditions that should be ruled out for those of you suffering from hormonal acne. These medical conditions are those that represent lend themselves to a hyperandrogen state, okay? Androgens are male hormones like testosterone, for example. There are certain underlying medical conditions that set the stage for hyperandrogenism. And women in hyperandrogen states tend to be plagued with not only hormonal acne, but also something called hirsutism, or excessive hair growth in a male pattern, you know, on the face and body. So for example, on the chin, the chest, the upper thighs, for example. Those features can be a reflection of a hyperandrogen state. Another feature of this tends to be irregular menstrual cycles as well. In addition to irregular menstrual cycles, the higher levels of androgens can drive oil production in the skin, so the individual can be plagued with oily, shiny skin, also called seborrhea, and can also affect the hairs on our head and lead to hair loss or alopecia, all right? Typically in kind of the crown area, if you will. It starts out as the central part of the hair gets wider and wider. That is also a feature of these conditions. Other features include deepening of the voice, as well as struggles with infertility. And going alongside that, struggles with obesity, and as well as setting the stage for another endocrine disease, type 2 diabetes or insulin resistance. So what kind of conditions set the stage for this? Well, probably one of the most common is a disease of the ovaries called Polycystic Ovarian Syndrome, categorized by irregular menses, hormonal acne, oftentimes hirsutism, and fertility problems. Very, very, very rarely, okay? So I say that so as to not alarm anyone suffering from hormonal acne, but very, very rarely, a new onset severe hormonal acne, as well as some of these other features that I've talked about, can be the hallmark of a androgen secreting tumor in the ovaries, okay? We also have another endocrine gland in our body called the adrenal gland. This makes a lot of our stress hormones. It makes a lot of hormones that help us deal with salt so that our blood pressure stays okay. And that little organ can sometimes be dysfunctional as well. Probably one of the most common diseases of the adrenal gland that would result in hormonal acne and may not manifest until later on in life is something called congenital adrenal hyperplasia, or CAH. This condition reflects an underlying deficiency in an enzyme that the adrenal gland needs to make hormones properly. And the deficiency of the enzyme can be variable, and the level of the enzyme can be variable. Therefore, the age of presentation of the disease and the degree of symptoms and manifestations can vary quite a bit, but it's probably one of the more common medical conditions that would be of concern potentially in somebody suffering from hormonal acne and would need to be evaluated. Very, very rarely, the adrenal gland can also have a tumor. It's very, very rare. And then the third organ that needs consideration and can be abnormal in women who present with hormonal acne is our pituitary gland. It's a tiny little gland inside of our brain that releases various hormones and signals that kind of keep everybody in check, and sometimes it too can go awry, secrete abnormal levels. Sometimes it can develop either a benign or cancerous type tumor that can that can really put your hormones, quote, out of whack, okay? But that is incredibly rare as well, okay? So probably the most common medical condition that underlies the state is polycystic ovarian syndrome. So it's very important that you be evaluated. There's certain blood tests that need to be ordered. Oftentimes some imaging of the ovaries, for example, may be ordered. So you need to not only see your general health care provider, but oftentimes your gynecologist as well. And in some of these rarer conditions that I described here, an endocrinologist would be another specialist that would probably be solicited at some juncture in your workup and brought onto the team to manage your workup and make sure that you're being properly evaluated for all potential things that could be going on. But more often than not, I think probably far, far more common than any of these, people will say, well, I had the hormone tests and they're all normal, but I still have acne and I still have a little bit of hair growth in a male pattern on my face and body, or hirsutism. What's up with that? Like, why do I have this, right? I mean, it is unfair, okay? It's unfair. Yeah, most women with hormonal acne and hirsutism have the exact same hormone levels as everybody else, as all other women. There's no hormonal abnormality, period. And so that's good. It indicates that the acne and hirsutism is not due to an underlying problem with the ovary or adrenal gland or pituitary. But if you'll recall back to some of my other videos, I talk about an enzyme in the oil gland and in our hair follicles called 5-alpha reductase. This enzyme converts the male hormone testosterone that we all have in our body to a more potent form called dihydrotestosterone. And some women have very, very high levels of the 5-alpha reductase enzyme, specifically in their oil glands, the sebaceous gland of the face. And so they churn out dihydrotestosterone just there in the skin. Probably it's posited and theorized that this is the underlying driver in hormonal acne, leading to more oil production and cystic acne in the jaw area. That's why we think there's a slightly different distribution of the acne, that for whatever reason those oil glands pump out have the 5-alpha reductase activity much higher. So it's more a hormonal problem just within the skin rather than a systemic, global problem in the rest of the body. So I mentioned there that the skin of women with hormonal acne can have a higher sensitivity of the dihydrotestosterone, more activity of the 5-alpha reductase. But another thing to consider is that another driver of oil production and sebum production in the skin that is hormonal, and often woven into either those individuals with PCOS, as well as all comers with female hormonal acne, is something called insulin-like growth factor, okay? And what that is a hormone that is released in response to a glycemic load, essentially. And it helps us manage some of the metabolism of the foods that we eat. However, when it is too high, it can have damaging effects, and it drives oil production in the skin, okay? So individuals who have obesity, consume a diet that is high in processed sugary foods, have higher levels of insulin-like growth factor that are thought to exacerbate hormonal acne and be a key player in its pathogenesis, okay? So what you need to know as somebody suffering from this is seriously evaluate your lifestyle and diet. If you're somebody who eats a lot of candy, you may want to back off on that, because that's going to amp up insulin-like growth factor. It's just going to drive oil production and make your hormonal acne a lot more difficult to deal with. Everybody always wants to know, well, what food should I be eating for acne? Can you talk about a diet for acne? Honestly, the data for that is kind of, all over the place, okay? Most things are theorized. The thing that we seem to see is a correlation with not necessarily dairy consumption, okay? That gets amped up to levels that are quite high in the media. I mean, people are all terrified of dairy, fine. But really what it boils down to, and what the studies show, is that people consuming fat-free skim dairy milk have more resistant acne than those who consume full-fat dairy milk, okay? So for whatever reason, the media just demonizes all dairy, and dairy could be problematic for sure, but as it stands now, where the data lies, it really suggests that perhaps overconsumption of skim milk, for whatever reason, we think having to do with driving insulin-like growth factor in the skin, can exacerbate acne, and particularly hormonal acne, and we think it has to do with insulin-like growth factor. But, whether or not you need to go vegan, whether or not you need to completely eliminate dairy, if you eat a piece of cheese, I mean, I don't think you need to, beat yourself up over that, okay? I mean, acne is a disease. you have it, and eating a piece of cheese, you know, is not going to make or break your face, okay? Literally. Overconsumption of sugary foods can make it tougher to get rid of. Overconsumption probably of skim milk, you know, too, can probably drive it to a certain extent, but, you know, overwhelmingly so, this is a disease. There's an internal basis. The foods that you eat certainly can impact that, but it's hard to define a diet because there's so many biases that come into those kind of studies that it's just really difficult to give a solid recommendation on that. But for overall health, for overall well-being, and just, you know, kind of anti-inflammatory purposes, the less processed stuff that you eat, the better off you are, honestly. I mean, that just never correlates to any health benefit. So, you know, the more kind of plant-based foods that you eat tends to serve you better. So really evaluate your diet, you know, and if you're eating things that come out of a window, those are generally bad news bears. If somebody hands you your food through a window, probably not helping your skin or the other organ systems in your body. But don't beat yourself up over those kinds of things. I mean, it's not like you got acne because you ate at McDonald's once, okay? There's a genetic component, and, you know, so don't beat yourself up over these things. So everyone wants to know, well, I have it, how do I get rid of it? How do I control breakouts? You know, what sort of skincare should I be using? As far as skincare, you know, there's really no mask or peel that you should, you know, be pursuing for this. Honestly, for the most part, all of that stuff is highly irritating on the skin, and irritation on the surface of the skin brings the immune system there to kind of repair it, and in doing so exacerbates any type of acne, really. So all of these like DIY pore masks and apple cider vinegar things, they're, you know, discouraged because of that. They cause a lot of irritation. They can actually set the stage for an irritant dermatitis and a chemical burn, even if you're using something like apple cider vinegar. Basic cleansers that are fragrance free, I can list some down below, are a good starting point for simply removing makeup and sunscreen throughout the day. At nighttime, you definitely want to continue to use a moisturizer and not fear that it's going to clog your pores or break you out. Generally, those labeled non-comedogenic are thought to be okay, but others will refute that in the comments. And so, you know, I can never predict 100%, but I can list some down below that in my experience are very well tolerated for all comers across the globe, and people with acne, hormonal acne, do not have problems with those. Just a basic fragrance-free moisturizer. Honestly, stuff that you get at the drugstore is, in my experience, in my opinion, better than anything high-end that you could buy, because it tends to be no nonsense and least likely to irritate your skin, and more affordable, so something that you can sustain long-term, okay? Because you can't just bail on your skincare routine. So a fragrance-free moisturizer at night and a fragrance-free moisturizer with a sunscreen during the day. I can list some down below because I know the aesthetics of sunscreen and acne are a touchy subject. A lot of times people feel like it makes the acne look worse, it clogs the pores. Some of the sunscreens have a mineral component to them that kind of glom onto things, dry out some of the acne while kind of irritating some other areas. I hear you there. I will list some down below in the description box that are very well tolerated, okay? As far as toners and astringents, skip all of that. Honestly, there's really no role for a toner. For the most part, toners are alcohol-based things that really just dry out the skin. And by alcohol-based things, I mean they have a high content of alcohol in them, and they're drying by virtue of that, okay? And I say that because a lot of people are afraid of alcohol as an ingredient in skincare products, and you really shouldn't be. Alcohol, you know, is added to many skincare products to stabilize the ingredients, and it's added in at such a level that it's not drying. But in like a toner, for example, like a classic toner and astringent, it tends to be very, very drying. The one astringent that I do think is good and worthwhile and can be helpful, the data supports it, is alcohol-free witch hazel, okay? That is really just gentle and soothing. If you've got kind of inflamed lesions of acne, that could be very, very helpful. But really, hormonal acne is not going to go away with like a skincare routine. You definitely need to be seeing a dermatologist for ongoing management, and you need to follow up consistently, because nothing that is prescribed is going to work you know, overnight. It generally takes a couple of months, okay? So what types of things are going to be prescribed? Well, for, you know, oftentimes what will be prescribed are some topical creams in combination with a medication, okay? And then later, maybe other medications are added onto it, okay? So that's why it's important to follow up, is it's kind of a stepwise thing of getting some things under control, calming the inflammatory lesions down, then withdrawing some things and adding new things on, okay? So it's not something where you can show up there once and then, you know, feel like, you know, they didn't really help you too much and then bail, okay? Because, you know, they may have a long-term plan that you're not really allowing to go to fruition by just bailing on your follow-up visit. So that's very important. So things that would be prescribed oftentimes to go on the skin are topical antibiotics like clindamycin. Benzoyl peroxide is another commonly used ingredient in the skin. Also, an ingredient that tends to work quite well topically in hormonal acne is something called dapsone or Axone. You know, there are a variety of topical creams that the dermatologist may choose based on their evaluation of your acne, how inflamed it is, those types of things, and your overall skin type, your skin color, your background skin, how likely you are to be somebody who suffers from post-inflammatory hyperpigmentation. Those will all kind of dictate what percentage strength of things they choose. They may also choose to start you on topical tretinoin or a retinoid like Differin, for example. Those things can all be helpful as topicals for sure, and helpful, but oftentimes, for the most part, not enough on their own. Oftentimes something that you have to ingest, and ingest on a long-term basis is needed. And so one of the things that is first often started to get good control of the acne is an oral antibiotic, okay? I mean, that's kind of for all comers of acne. And it's used, you know, oral antibiotics include things like doxycycline, for example. Always look, guys, by the way, in parentheses, what the name of the drug you're taking or putting on your face is. People always want to know about the brand names. Always look at the actual drug in parentheses, okay? And force yourself to say that, because, you know, the brand names, they change all the time. It's kind of like, you know, Nike, Adidas, but you need to know you're putting shoes on your feet, okay, at the end of the day. It's sort of the same principle. Okay, so oral antibiotics are often prescribed not as anti-infectives, okay, not because you have an infection, you know, per se, but they have profound anti-inflammatory effects, okay, so they can really put the brakes on acne, and do a good job and have a long track record. There is always a concern with oral antibiotics that, you know, the longer you are on them, the more it puts you at risk for the bacteria that normally live on our skin and in our body, developing resistance to the antibiotics and causing problems with resistant bacteria. Not resistant acne, resistant bacteria, okay? And so that is a side effect that seems to be uncommon, honestly, with oral doses of antibiotics for acne, but is always in the back of the treating physician's mind, and the goal is always to have you on it for the shortest amount of time. That being said, many people are on oral antibiotics for, you know, a year, a couple of years. It's not, you know, what's set out, but oftentimes it's what works and what the individual complies with the most, okay? The goal usually is 3 to 6 months at the most, and then backing off, but that doesn't always work out, okay? It's very individualized, all right? But other oral medications, in addition to antibiotics, that are very helpful for hormonal acne are oral contraceptives, as well as spironolactone, and in some cases Accutane can be helpful for hormonal acne, okay? So it's very important that you follow up with a treating dermatologist so that they can kind of gauge what spectrum of treatments will best serve your acne. But you need to know that no treatment is going to work overnight. For the most part, it takes you know, at least 3 months for you to start really seeing effects, and follow-up is very, very important. But anyways, guys, I hope that answers all of your questions about hormonal acne. I'm going to conclude the Q&A here. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.